morning, good afternoon, and good evening to our speakers, chairs, and audiences of the ACNS webinars in different parts of the world. We are back again with another week of educational lectures for you. The first speaker for today is Dr. Adam Omar, who was the previous Global Neurosurgery Fellow at the Global Surgery and Social Change Program at the Harvard Medical School, Boston, USA. Dr. Omar is in his residency at the Albert Einstein College of Medicine, Montefiore Medical Center, New York. He has conducted research on global neurosurgical workforce, barriers to training, and patient access to and affordability of care. He works in close relation to the Global Neurosurgery Committee, WFNS, and has studied to develop global action plan to achieve universal access to safe, effective, and affordable neurosurgical care. He is a co-founder and assistant editor of the Journal of Global Neurosurgery. We are extremely thankful to Dr. Ammar for accepting our invitation to be a speaker today, and he's going to talk about roadmap to global neurosurgery in Afghanistan. The second speaker for today is Professor Fawad Pirsad, who is the president of the Neurosurgical Society of Afghanistan. Professor Pirsad is the professor and head of Department of Neurosurgery, Aliabad University Hospital, Kabul University of Medical Sciences, Afghanistan. We are extremely thankful to him for accepting our invitation to be a speaker for today's webinar. The chair for the first session of today is our honorable guest, Professor Abdussamad Al-Awhabi from Morocco. Professor Al-Awhabi is the professor of neurosurgery and chairman of neurosurgical department at the Hospital des Specialités Ibn Sina University Medical Center of Rabat, Morocco. Dr. Al-Awhabi is the past president of the Moroccan Society of Neurosurgery. He is a founder and an active member of many regional, continental, and international scientific societies. He has also served as the WFNS second vice president. He has important contributions to education and training, mainly in the WFNS Rabat Reference Center for Young African Neurosurgeons in many neurosurgical subspecialties. We are extremely grateful to Professor Al-Awhabi to have accepted our invitation to chair the first session of webinar today. The second chair for today is our honorable guest from USA, Professor Robert Dempsey. Professor Dempsey is the Manusher Javid Professor and Chairman of Department of Neurosurgery at the University of Wisconsin. He specializes in cerebrovascular surgery of intracranial aneurysms, carotid endarterectomy, brain tumors, and co-direct UW stroke programs. With over 35 years of NIH funding, Dr. Dempsey has multiple research projects with a focus on cerebral ischemia, vascular cognitive decline, and repair of the injured brain, with over 300 publications. Dr. Dempsey is an award-winning educator and mentor, training a generation of students, residents, and faculties worldwide. He is three-time winner of the Clinical Teaching Award as voted by the students. He is the past president of the Society of Neurological Surgeons and chairs the Foundation of International Education in Neurological Surgery. We are extremely thankful to him for accepting our invitation to chair the second session of today's webinar. On behalf of the Education Committee of the ACNS and the President, Professor Yoko Kaito, I would like to welcome both the speakers and chairs for today to this online platform of ACNS webinars. Dr. Liu Bun Singh from Malaysia is my co-host for today, and with that introduction, I would like to hand over this platform to Professor Al-Awhabi.
Thank you very much. Thank you very much, Dr. QT, and the organizer of this webinar on behalf of the ACNS. This is very important webinar, as I said, on education and more particularly on global neurosurgery. Thanks to Professor Yoko Kaito for her active participation in global neurosurgery for many, many decades, and also for organizing such webinar. I would say just after your presentation of Dr. Adam Ammar that Dr. Adam is a very young, engaged neurosurgeon. I was very pleased to work with him in the Global Neurosurgery Committee. He is a very active member of Global Neurosurgery Committee Secretariat team, and he organized many webinars and participated in many surveys. So he is very active with the team of Professor Kipark. So it's a pleasure to have him today for presenting his presentation regarding the global surgery. And please, Adam.
Thank you, Dr. Al-Awhabi. Thank you for having me today. So I wanted to talk today about what we've been doing for the past year with the Global Neurosurgery Committee, and that's creating a roadmap for capacity building of neurosurgery in countries, and in particular our work in Afghanistan. I have no disclosures. And just about me, as Dr. Al-Awhabi said, I am very young, so please take what I say with a grain of salt. I'm still learning a lot, and there's a lot to be learned from the titans who will be speaking here today, and who have been great mentors for me along the way. So today I want to talk about what is global neurosurgery, the history of global neurosurgery, and how that has led to the development of global surgical indicators, the components of surgical systems, and how that has impacted our work in Afghanistan to improve neurosurgical care there. So global neurosurgery, as we define it, is the clinical and public health practice of neurosurgery with the primary purpose of delivering timely, safe, and affordable neurosurgical care to all who need it. And this is the definition that we work with at the Global Neurosurgery Committee, understanding that the term global neurosurgery has never really been fully defined, and throughout its history has been used in different ways. But really the public health practice is the main component that we focus on. And this really comes from the Lancet Commission on Global Surgery from 2015, the seminal paper that really brought global surgery, obstetric and anesthesia care to the front in the global health community. And they found that there are 5 billion people across the world who lack access to safe, affordable surgical anesthesia care. This equates to 143 million additional procedures needed annually. Of those patients that need surgery, 33 million face catastrophic expenditure after receiving their surgery, which means that they can no longer afford to buy food, pay for shelter after they've had their surgical care. All this means that investment in surgical anesthesia care is extremely important for the health and economy of the entire world. When it comes to neurosurgery, specific to our specialty, there have been studies that have shown that there are 22.6 million patients that suffer from neurological disorders and injuries. 13.8 million of them require neurosurgical care. And in order to meet this need, approximately 23,000 additional neurosurgeons are needed from the current capacity that we have in order to take care of all of these patients that need neurosurgical care. And for this, there's definitely a discrepancy in where the care is. High-income countries have many neurosurgeons, but large areas of the world have only one neurosurgeon for 10 million people, which simply isn't enough. And these gaps in care are mostly centered in low and middle income countries, specifically in Africa and Southeast Asia. And there's usually been this notion that neurosurgery is too expensive. And so low and middle income countries can't invest in it. But they found that it can cost the same as doing an appendectomy for some essential emergency neurosurgical procedures. And so it is affordable, it is worth investing in. And most of the work that has been done in the past is really focused on neurosurgical training. The neurosurgical societies, regional, country level, such as CONS and ACNS, have done a lot of work training neurosurgeons, not just at their regions, but globally. World Federation of Neurosurgical Societies has done a lot to build neurosurgical training programs around the world. And outside of the societies, groups like FEANS and Cure Neurology have also developed programs everywhere to train neurosurgeons. And they've done a tremendous job. There's 27 country sites for FEANS. WFNS has 21 active programs in 13 different countries. There are multiple ongoing programs from all the societies, such as Project Africa 100, the All India Institute of Medical Sciences, and on and on. We have done a lot of work, and there's been a lot of progress in training neurosurgeons. But in 2016, at the World Congress of the WFNS, there was this paradigm shift with the Bogota Declaration on Global Neurosurgery. And what that declaration said was that we have this large need that has been determined by the Lancet Commission, by the research specifically for neurosurgery, that this need is centered in low and middle income countries. And it is our responsibility as a specialty to make sure that neurosurgical patients have access to the care that they need, and that we as a global community of neurosurgeons work together to do this. And it's not just by training neurosurgeons, but by looking at the larger picture of the systems of neurosurgery. And so what do we mean by that? The Lancet Commission came up with these 6 global surgical indicators. Access to timely essential surgery, which means that there should be neurosurgical centers or neurosurgeons, some kind of access to care that for the Lancet Commission was said to be within 2 hours access to a hospital or center that they could receive that care. For neurosurgery, we found that it was more closer to 4 hours. Surgical anesthesia obstetric density, the number of physician proceduralists, we don't have a specific number for neurosurgery, but it was said to be 5,000 per 100,000 population for the surgical density. But pretty much it means that we need to have a specific number of neurosurgeons, and it will vary from country to country to be able to care for all of the patients in that country. That is the workforce number. Surgical volume means that when you have those neurosurgeons, do they have the capacity, do they have the equipment, the infrastructure to perform enough surgical cases to care for everybody that needs it. And then outcomes measures, perioperative mortality. It's not just enough to perform procedures, but we should be performing them safely. We should be having a goal of a 0% perioperative mortality rate. And then lastly, there are 2 indicators for financial risk protection, meaning that a patient should never have to choose between having a neurosurgical procedure and feeding themselves and their family. And so when you're trying to develop this surgical system, what are the things that need to be considered when you are looking at the system as a whole? And there's these 6 components of a surgical system. Infrastructure, which are the physical aspects that are needed, the hospital facility, the CT scanners, MRI, the neurosurgical instrumentation that are needed to actually carry out the procedures. And this extends beyond just neurosurgery. There's a lot of overlap. Blood supply systems, electricity, running water are all things that need to be considered. Workforce is one thing that we as a specialty have done a very good job of working on, but we still have a long way to go. Because it's not just about training neurosurgeons, but the neuronursing staff, the operating room technicians, the anesthesiologists, pathologists, radiologists. We work within a team, not within a silo. And so it's important to consider all of the people that work with neurosurgeons and how do we help build them up as well. Service delivery is when you take those 2 aspects, really, the equipment that you have, the people that you have, how do you make sure that you are providing that care to the patients? So how do you coordinate the care? What does the system look like? How do ambulances get people to the hospital? Do you have to go to one hospital where the neurosurgeon is and the CAT scan is at a different hospital and you're driving back and forth and losing valuable time that way? Financing is always extremely important. How do you pay for this? It's nice to say we need all these things, but there are limited resources, and especially in low middle income countries, they a lot of times have to decide between where they're going to spend their limited resources. And so figuring out how to best find the funding in order to implement these measures is extremely important. Information management is the data collection systems. We cannot improve what we cannot measure, what we do not measure. And so having the systems available to collect data and then to share that data. The biggest improvement in this, at least in high income countries, has been electronic medical records, the ability to disseminate information on patients and share it. But there are still a lot of roadblocks for that, and it's not a perfect system. But this goes beyond even that into research as well. And then lastly, governance, policies, and the political structure around this. Things like helmet laws in a lot of countries can have a great impact on neurosurgical care and neurosurgical systems. And it has nothing to do with the healthcare system as we know it in terms of the hospital, but is extremely vital to improving care for our patients. And so then when you're looking at the system, you have to look at the continuum of care as well. And that goes from surveillance to prevention, pre-hospital care, the actual surgical system where a lot of neurosurgeons work, then even after they have their surgery, rehabilitation. And all these aspects need to be considered. And this is taken from the comprehensive policy recommendations that the Harvard group created for head and spine trauma, and they're creating one for spine, a bifida and hydrocephalus at the moment as well. All these things that need to be considered. So how do we get there? What we've done in the past has been a lot of people working next to each other, working in similar areas, doing similar things, and it's kind of come into this jumble. And what we want is well-oiled, machine where everybody is communicating with each other. Everybody knows what each other's doing. They're able to collaborate. We're not wasting resources, duplicating efforts. And so the WFNS Global Neurosurgery Committee was created with this idea of how do we bring together all the efforts of neurosurgeons around the world to address this issue. And they came up with 5 aspects, objectives for the global action plan. And these are based off of the components that I was just talking about. Amplifying access means that we make sure that everybody has safe, affordable, and timely access to neurosurgical care. We advocate for universal coverage, meaning that we make sure that we are speaking out, that we're using our influence in order to make sure that this issue is on the agenda for governments, for other organizations. We align all the global neurosurgery activity. We make sure that we're all working in conjunction with each other, collaborating, and not duplicating those efforts. Advancing relevant research, this is extremely important because the majority of research in the past has been done by high-income countries. High-income country actors have gone to low and middle-income countries. And they've worked with partners there, but it's still focused on where the grant funding comes from, what the priorities of high-income countries are. And we need to change that dynamic to low and middle-income countries really need to have capacity building to be able to do the research on their own, to be able to focus what their priorities are, what their local contexts are, and make sure that we understand the data from them and create standards that are different to ones that might not necessarily work, that come from high-income countries, but might not necessarily work in other contexts. And lastly, assimilating neurosurgical capacity. We don't work in a silo, and the global health community is doing a lot of work, and we should make sure that we are aligning with what they are doing, that we are working in conjunction with them as well. And so how do we do this at a country level? So there's National Surgical Plan Framework was created, and it takes multiple components that you need to take a look at that are born from those components of the surgical system that I spoke about earlier. And so to begin with, you need ministry support. You need buy-in from the government. They're not going to support you, then you're going to find it a lot harder to do what you want to do at a national scale. You need to do a situational analysis. What is the situation right now? What are the current deficits? What are the needs? You can't start fixing things until you know what the problem is. And then you need stakeholder engagement and priority setting. You need to bring in everybody who's interested in this, who wants to help out, make sure everybody's on the same page. And then you go through drafting and validation, which means you come up with your proposal for what you want to do. You monitor and evaluate it by taking a look at how are we going to make sure that we're staying on target. We figure out what the cost of it is, we figure out what the policy measures are needed, and then we finally implement it after we've checked all the boxes. And we created a strategic planning framework for specific to neurosurgery based off of this. There are the 6 components: infrastructure, workforce, service delivery, information management, finance, and governance. And within that, there are multiple questions that should be answered, that need to be considered in order to determine, do we have all the infrastructure necessary within this country to provide neurosurgical care? Do we have the appropriate workforce? Do we have the measures in place to monitor this and evaluate what we're doing? Do we have the funding for it? And you go through all these questions, and after you go through this entire framework, then you come out with an idea of what the current needs are, what's the current capacity, and then you can start thinking about what are our priorities, what are the things that we want to fix, and how are we going to go about improving them. And at a hospital level, we also have a hospital assessment tool that we created that allows you to determine the capacity and specific needs of individual hospitals. You know, do they have access to oxygen all the time? Do they have access to electricity all the time? What kind of procedures can they do? What neurosurgical equipment do they have? Do they have a CT and MRI on site? What staff do they have? And this allows you to create a stratification of the hospitals around the country and guide allocation of resources. Not every single hospital needs to be a neurosurgical center, but you want to understand what the capacities of all the different hospitals around the country, so that way you can create a system in order for triage, prevention, providing the care, and then for any kind of transfers, and creating a system where the patients can be safely taken care of in the best manner and in the most efficient manner. And so we've gone through this process. We started it in multiple countries. Afghanistan is one that we're working in, but we've also done it in Sudan, Tanzania, Senegal, Myanmar, Bolivia, and the Caribbean community as a group of island nations to create a regional plan. And so for Afghanistan, the first step is always bringing together the people, the interested parties. And so the Afghanistan Neurosurgical Society, Dr. Perzad, who will be speaking today, is the current president of it. And this is extremely important to bring together the local neurosurgeon, because this needs to be a locally driven effort. As hard as anybody outside of the country tries to help out, they will never be as successful as the neurosurgeons there, who are more invested, who understand the context better, and who understand how everything works and can implement this. And our first objective after we get everybody together is to collect data. And so there is a minimal data really in Afghanistan that is out there. And so we try and pull it together, but you can't improve what you don't measure. And data collection is always extremely important. And so we were able to create this map for Afghanistan, looking at where are the neurosurgical centers in the country. And from that, we were also able to discuss what are the priorities. And they found things that aren't unexpected. Training is important, communication amongst the neurosurgeons is important, equipment is needed, and research is always necessary. And so that's where we came up with a basic SWOT analysis as this is the beginning, but this is only just a start, is to take a look at what are the needs that are there, what are the weaknesses of the system, what needs to be improved, what exists in place, and what are the opportunities that we can do to improve it, and what are the things that could prevent us, what are the obstacles that need to be overcome for these. And so after you go through all of that, how do you implement the change? And I just want to reference Cotter's 8-step change model. This is created for any organizational change, but this goes for change even at a national level for the specialty. What you want to do at first is create urgency, form a powerful coalition, create coalition, and create a vision for change. And this is really the step that we're at with Afghanistan. It's been a long time that we've been working with them, and we're still at the beginning because this is such an important thing that we have to get it right at the beginning. We have to make sure that we have everybody on board, because if they're not on board, you can't expect them to buy in and make the necessary changes. And then from there you go and you empower action, you give the resources, and it's important to create quick wins. It's nice to have a long-term view of how things should be changed in the country, but you need to have short-term goal sets that people can see that they're making a difference and understand the impact that they're having to keep up morale and to keep the momentum going forward. Then after that, it becomes a continuous effort. Once things improve in the country, we cannot say we've done our job and step away. It requires continuous efforts, and we should always be checking in with each other and helping each other because there's always room for improvement, but things could always backtrack as well. So we should always keep up these efforts. And so the future here, there are some things that should be focused on for us as a community is increasing the development of human resources. We do a good job of this, but always taking a look at other workforce numbers besides just neurosurgeons. Task shifting and task sharing is something that should be explored. We should encourage neurosurgical research from LMICs. This is extremely important. We need the data, and the best people to collect that data are the people in the countries. We should promote innovations that are practical, cost-effective, and context-specific. Taking microscopes and CT scanners from high-income countries and just dropping them into a low-income country does not necessarily work. It's not the best tool. Creation of equipment that is context-specific, based off of climate, based off of infrastructure needs, all these other aspects that go into the design of a product need to be considered. And we should be taking a look at how do we make equipment that is specific to these contexts. We should be advocating using our platform to address the unmet neurosurgical need and then position ourselves. Neurosurgery has always been a leader within its own specialty, within its hospitals, within the larger medical community, and we should position ourselves as leaders within the global surgery community as well. And I just wanted to put a little plug for the Journal of Global Neurosurgery. So we have a fully open access journal focused on global neurosurgery research. We're looking for representation from all regions of the world, develop research building capacity for researchers specifically from low and middle income countries. And we want to support the research efforts of low and middle income country researchers. And so we can't do this on our own. It has to be, it's a grassroots really effort. And so it requires researchers to buy in and to support it in order for it to work. And it requires our efforts as a global community to support each other's works. Thank you.
Thank you, Adam. Thank you. Thank you. This nice presentation. I think that you have summarized the Global Neurosurgery Committee activities that which launched in 2019 in Kinshasa. And there are many steps that has been achieved, and we are looking forward for more improvement of the situation. As you know that even with all these efforts, the inequity of neurosurgery in the world is still striking due to the lack of, as you say, the cohesive global strategy. This is, and it is very important that all the people who has been engaged and this global surgery should combine their efforts for the same goal, not to duplicate, but for a combination of all efforts. And the example you see in Afghanistan is one example. So it is very, very important to follow the steps for future improvement of the situation worldwide. Thank you for your presentation.
Thank you so much. I think we can take a few points from Professor Dempsey and Professor Aziz Sultan as well. Professor Dempsey.
I'm very happy to hear this talk. Adam, it's quite excellent work. There are several themes that Adam brought out that I think we should all hear when such a talk takes place. I mean, the first thing I heard was partnership, that this is a partnership of people throughout the world. And is a bi-directional learning process. That's very, very important because the program must have ownership by the people of the region being served. And they must develop that program for and by the people of that region. And so while the global neurosurgery community is trying very actively to educate, organize, etc., the global neurosurgery community must also listen. And this is very, very important. That's a part of partnership. The next important message I heard was bidirectional. And that is that when one does the research, the next point that he made, you learn so much from the people that you thought you were serving. They're actually educating you in their magnificent abilities to care for people in low and middle income countries. And what we learn from them are techniques which have changed high income country neurosurgery much for the better, about efficiency, about caring, about completeness of the care, and about the broad delivery of care throughout society. The other message I heard, which Adam didn't really think he was developing, but he was youth. The energy that we get from the young members of these committees, from the young people in the countries of low and middle income countries. I always, when I travel, want to see the residents. I want to see the med school students that aspire to be neurosurgeons. I see the diversity in that. I see the remarkable and wonderful input of female neurosurgeons and female students. I see the youth which have this remarkable ability to use the electronics to really look at that. We saw GIS maps of Afghanistan today, which really showed us that the modern science developed to this problem, delivered by the youth, is the way to go. Because they literally can look at a region and say, this is the exact number of minutes it takes to get a patient to neurosurgery in this region. This is where the people are. We must improve the transportation and the services. And finally, research, the other message that Adam made. He emphasized this multiple times, and that's very important because we will never succeed staying where we are. And when a physician looks at a patient and says, this is the best care in the world that I'm delivering today, and it's not good enough for this patient, I care that much about them, that I will improve it, you then start to do research. And when, Adam, when you tell us about what you found as you did today, you are teaching. And that really is the way we grow, is by patient-directed, patient-focused research, service, and listening. This is a wonderful talk. I'm very, very pleased to be able to participate. Thank you.
Thank you. Thank you so much.
Thank you.
Absolutely insightful thoughts. Yes, Professor Sultan.
Thank you. I'm very much looking forward to Dr. Pirzad's talk. Allow me to share a small story that highlights the wonderful points that Dr. Dempsey just made and what Adam talked about. So I'm a neurosurgeon in Boston. I graduated in 2006. I was trained by the icons of neurosurgery, Spetzler and Harros and so forth. But I'm originally from Afghanistan. I'm a refugee. I left when I was 6 when the Russians invaded. And I've always had a desire to go back and help. And so as soon as I graduated, I went and I looked around. And just by chance, I met one of Dr. Pirzad's partners, Dr. Manawi, who worked at Ibn Sina Hospital. And on that morning, I followed him and said, I want to figure out what's going on. I didn't even know if there were neurosurgeons there. A 16-year-old boy came to the ER, and there were residents who saw him, residents that actually lived in the hospital for 2-3 years. That's where the term comes from, and said, you need a CAT scan. This is one of the main hospitals. And so the boy was thrown in a cab, taken across town by his brother, had a CAT scan. The CAT scan went to Pakistan. Somehow they got a copy of it, came back. On the way back, he herniated. The boy herniated. They rushed him to the operating room with the CAT scan there. I have pictures of all of this. And I went in as the big professor, like, here I come, I'm going to help out. And Dr. Manawi pushed me to the side, said, would you mind if our students go? And with the drill, they were able to operate in such a swift manner, without magnification, without anything, things that I couldn't do. And it was really, really wonderful to see the enthusiasm, the drive, despite limited resources, the talent and enthusiasm these people brought. Like, so Dr. Dempsey is saying there is bi-directional learning. They have capabilities that are beyond my capabilities, beyond. The other thing is the concept of leapfrog technology, right? And the concept that people in Afghanistan and villages had satellite phones before they had electricity. What's coming down the line in the United States, in Boston here, are imaging solutions and workflow optimizations that will actually Uberize medicine, right? So right now there could be a patient in the CAT scanner, just like this boy was taken to a CAT scanner, that had a stroke or something, and I can see it on my phone, 2 minutes. And so that helps communication and access and interpretation through places that may not have a radiologist or know-how or a CAT scanner. So I think with places like Afghanistan, the people are there. They're wonderful, wonderful. Afghanistan was the Paris of the Middle East back in the day, and 40 years of war has made it difficult in the country, but there are exceptional people here. And Dr. Pirzad is one of them, and I would love to hear that talk. So thank you for those comments.
Thank you so much. Nothing is more valuable than coming it straight from the heart of the son of the soil. Thank you so much, Professor Sultan. So I think we'll come back to the discussions later, but as I understand, Professor Al-Awhabi is ready to go to the theater. So thank you so much, Professor Abdul Samad Al-Awhabi, for joining us today. We are indeed so honored to have you. So maybe proceed to our second lecture, for which I invite Professor Dempsey, and Professor Dempsey will invite Professor Ahmad Fawad Pirzad, who is here, to give his lecture. Over to Professor Dempsey.
Thank you very much. It's my honor to introduce to us Dr. Swot Analysis. Dr. Prasad is professor at Kabul University of Medical Sciences in Afghanistan and is the chief of the Department of Neurosurgery at the University Hospital. He has been a pioneer and leader in both education and training and treatment of patients in Afghanistan. And I have had the honor of listening in on his YouTube presentations to his colleagues, which are thoughtful, they're insightful, and they're inspiring to the youth. He is an excellent example of someone who has taken leadership of a situation in a low and middle income country and has really allowed it to achieve a very high level while he continues to work in training to develop and spread this level of care throughout his country. He is here today to talk to us about the situation of neurosurgery in Afghanistan, which we have been prepared for this talk by the earlier talk, which talked about the principles of education, infrastructure, and supply of an entire system of care. In other words, neurosurgery as a keystone specialty does raise the quality of care throughout the university. So, and the people that are served. So it's my great pleasure to introduce Professor Prasad, and I look forward to his talk on the situation of neurosurgery in Afghanistan today and the future. Professor.
Thank you very much, and welcome all of you, and thank to give me the chance to talking about neurosurgery in Afghanistan. I like to talk about neurosurgery in Afghanistan, and it's a short introduction. As you mentioned before, I'm Dr. Ahmad Fawad Pirzad, and this is my presentation outline. I like to have a short introduction about neurosurgery in Afghanistan, a short history, and about neurosurgery departments, military hospital, private, neurosurgeons, equipment, and challenges. Thank you for Dr. Amer that's present before, and he introduced about Afghanistan. I am not going for details, and as he mentioned, Afghanistan is one of underdevelopment and low-income countries. Suffered 4 decades war, poverty, and instability. And as Dr. Ali told, this 4 decades, it's an age, a long time. We suffer this war, and we tired about war, and this war has become our people power and our situation unstable. Like other parts of health, neurosurgery faced with many difficulties. As I mentioned, war and unsecure situation, work with limited resources, and bad ongoing military, political, and economic conditions make neurosurgery with difficulties. Fortunately, we have talented and educated people. Neurosurgery is growing up rapidly in recent years. Afghanistan's neurosurgeons proud to serve for our needed poor people. I like to mention about challenges that we are faced in Afghanistan. Neurosurgeons faced with many challenges. One I mentioned, it's war, an insecure situation. And it's this situation becomes to fear, to no interest for investment for the health or for the neurosurgery. And unfortunately, other thing is corruption. It's also make more bad. And we have more trauma and mass casualty cases. The other challenges are old and traditional equipment and material. Donation of equipment, but transportation and financial problems. Some countries, some neurosurgical societies donate some materials and equipment, but transportation and financial cost is much higher to carry it to Afghanistan. Other challenges, as Dr. Ali before mentioned, in Afghanistan, in public hospitals, unfortunately, we haven't no diagnostic equipment, no CT scan, no MRI. And also the other challenge that we are faced is limited ICU services. We find equipment and market, but they are low quality. Low quality equipment, drug, and material. Limited resources to update training of neurosurgeons, especially young neurosurgeons, for technologies and advanced operations. The other things that we all over the group are faced as COVID-19. This is also a barrier for extending our services, and also this barrier make stop training outside the country. And unfortunately, the other thing is brain drain due to bad situation in Afghanistan, war and poverty and unsecure condition. All our educated people love to going abroad, and it's not good for future of our people. Now, I like to mention about history of modern medicine in Afghanistan and also neurosurgery. Modern medicine and medical education was established by Turkish neurosurgeons, Turkish professors, and 1930. They established medical faculty in Afghanistan and hospital. As you see, this is hospital that's built by Turkish and destroyed, unfortunately, in ongoing war. About neurosurgery. Neurosurgery was established by French professors, Professor Chatouni and Afghan professor Dr. Abdelhamid Rahimi Maulana. He was a great man. He and French neurosurgeons established neurosurgery in Aliabad hospitals. Aliabad hospital is university hospital, and neurosurgery established in 1962. Professor Rahimi trained in France and became chief of neurosurgery department. He was member of national and international societies. He is the founder and father of Afghanistan neurosurgery. Rest in peace. This is the Professor Chatouni and Professor Rahimi, that's founder and father of Afghanistan neurosurgery. At the first, Aliabad University Hospital was only neurosurgery center in Afghanistan. And all over the country, only Aliabad Hospital was the center for neurosurgery. Aliabad Hospital have services for neurosurgery, teaching and research. We doing research all the times. Fortunately, we have women neurosurgeon in Aliabad Hospital. We have specialists neurosurgeons and also resident women neurosurgeons. We're proud to have neurosurgeons with us. And also services and residency training programs extended to capital public hospitals. This extended to Jamhuriyat Hospital. Before it was Ibn Sina Hospital, as Dr. Ali mentioned, Dr. Munawari, our senior experienced neurosurgeon, worked as a president and chief of neurosurgery department. Other hospitals, Sheikh Zayed Hospital, Dr. Qais, one of experienced and expert neurosurgeons, worked down there, and Jinnah Hospital, Dr. Maqsoodi, one of our fellow, worked as a chief down there. In military hospital, neurosurgery was established in military hospital in Anna, Afghanistan National Army Hospital by late Dr. Tutakhel and Dr. Suri. And also nowadays, Dr. Sahibi work as a chief in military hospital. Afghan National Security Hospital, Dr. Sikandar and Dr. Saif are working down there. Afghan National Police Hospital, Dr. Sadat. I simply mentioned the chiefs, not all of our colleagues. And they have in military hospitals best facilities and equipments and good achievements. As Dr. Omar mentioned, neurosurgery expanded to province hospital and medical colleges. In Herat, Dr. Irsad and Dr. Habib, Ningarhar, Dr. Jamil Khaled, Balkh, Dr. Qais Rahim, Khost, Dr. Bachazar Abdali, and Kandahar, Dr. Sabri, all working as chief, and they have senior and junior neurosurgeons. Other achievement is private hospitals. In private, rather than public hospital, we have good facilities and equipments and good achievements. We have Dr. Mujaddidi, Dr. Salman Yunus as a star of neurosurgery in Afghanistan. Other things is Afghan neurosurgeons who trains outside the country. They follow fellowships, have best achievements. Afghan neurosurgeons serve outside the country, be proud of us. They are Dr. Bashiri, Dr. Satar Raouf, Dr. Ashraf, Dr. Hakim Munib, Dr. Javed Khan, and Dr. Ali Sultan. That's mentioned before. And fortunately, we become together to make Afghanistan Neurosurgical Society. Afghanistan Neurosurgical Society become the member of WFNS, ANCS, and ACNS. It's important to mention about contribution of Turkish, French, Japanese, Russian, and American neurosurgeons for development of neurosurgery in Afghanistan. Education of neurosurgery. We have undergraduate education for medical students, and we teach basic neurosurgery courses and also practical works. Fortunately, we have a lot of medical textbooks, and this the first textbooks that's writes by Professor Rahimi. And neurosurgery education, we have postgraduate training, 5-year residency program for general neurosurgery specialty, and short training for general surgery residents. That's where we have in neurosurgeons in provinces. They work as first aid to help needs people. And we have also CME for like fellowships for government, sometimes WFNS and private fellowships. Also, we have a lot of textbooks for our colleagues in residency programs. As Dr. Omar mentioned, we have 74 trained neurosurgeons, senior neurosurgeons, and they have good graded neurosurgeons, MD, master, and PhD degrees, fellowships. And as we estimated, 2 neurosurgeons per million of population. 2 neurosurgeons only for 1 million population. And we are looking for national and international fellowships also. Our cases, most of our cases are neurotrauma cases. Trauma cases are during internal war. As we did research during war, 55% of our cases was war-wounded cases. 55% stats. And now the internal war stopped, but unfortunately, we have suicide bombers, explosions, mass casualties in schools, student, hospital, and mosques. Also, we have cases of unexploded war weapons, mines, violence, other cases of trauma, road traffic accidents, work and disasters. Other uncommon cases that we are facing in Afghanistan, like gas cylinder and cooker blast. This also make head injury and neurosurgery cases, non-trauma cases. We have also non-trauma cases, brain and spinal cord tumors, spine, and these pathologies. We have brain and spinal complication of tuberculosis. Unfortunately, we have a lot of cases of tuberculosis in Afghanistan. Complication of tuberculosis in brain and spine. We have a lot of peripheral nerves. We have brain and spine, cyst and abscess, hemorrhagic strokes, and we did spine instrumentation, fixation, fortunately in Afghanistan. We have a lot of operations, non-trauma cases, also on selective cases for, like invasive and mini-invasive operations. We have facility, small facility of microscopic and endoscopic facilities in hospital, in government hospital, but this I will show you old microscope, but fortunately in private we have a good microscope and endoscope in private clinics. We do craniotomy for trauma, gunshot wound, brain tumors, keys, and hemorrhages. We put DP shunts. We do laminectomy, traditional, microscopic, and endoscopics. We have spine surgery and fixations, peripheral nerves operation. Equipments. Still in our public hospitals, we use basic neurosurgery kits. I would like to thank Japanese Neurosurgical Society for sponsored basic neurosurgical kit in 2001. We still use it. Thank you for Dr. Kato. This is old CR microscopes. Maybe someone remember this kind of microscope. As we use portable X-ray machine and also this operating table. But we have great achievements. This is a brain tumor that we use with a Hansen breast with hand drill, and we remove the tumor. Fortunately, the patients survive and good. We do spinal fixation. I would like to thank French neurosurgeon Dr. Jacques Guetta, that he introduced transpedicular fixation for Afghanistan and trained us. But unfortunately, in the market now, we are faced at low and bad quality instruments. You see them there. We celebrating World Neurosurgeons Day with our colleagues. Thank you for participating. And this is our colleague, World Neurosurgeons Day. Conclusion. In conclusions, as a WFNS facility levels, now Afghanistan is in the level 1 facilities, because we are doing public hospitals macro neurosurgery, mainly trauma. And as I mentioned, we have old microscope, but in private microscope. And for this, I am underlines this line level 2. That's we are growing up, inshallah. Request from global neurosurgery to change old and traditional equipments and material to new. Donation of equipment, but transportation and financial support also important. We need diagnostic equipment, CT scan, MRI for public hospitals, for our poor people. We like to improve ICU services and training for this. We like good quality equipment, drug and material in market. We like capacity building. This is very important, capacity building, but training of neurosurgeons for new technology and advanced operations, fellowships and scholarships. I would like to thank you, Dr. Katu, that he promised that for training of our colleagues. The COVID-19 is also a barrier. Other things is brethren, if the situation becomes safe, we must stop brethren. We need also books, CDs, DVDs, and teaching materials. And the conclusions, but I end my speak, but think big, start small, act now. We would like to expand neurosurgery to all over country. We think big. We start small. Neurosurgery was started by one team, traditional methods, equipments, and materials. We have started training neurosurgeons for new technology and advanced operations. And we act now to send for you. Thank you very much. We like peace in Afghanistan. Please make our dreams become real. Thank you. Arigato gozaimasu. Shukran. Merci beaucoup.
Thank you so much.
Shukriya. Thank you.
Professor Dempsey.
Thank you very much, Dr. Swot. Dr. Prasad, this is a wonderful description of what people have done in a difficult situation and done so well. There's much for us to learn here. The number one point which Dr. Prasad made, and this is true everywhere I go, is the quality of the people. And by this, I mean the people doing neurosurgery, the people receiving neurosurgery, and the people who quietly support us. And that does not simply include our well-trained technologist who helps us with the instruments in the OR or our nurse in the ICU, but that includes that the people of the region that are dedicated to improving care for the children or the adults that have neurosurgical problems. That's an ongoing point that I want to make, because we learned how this group of neurosurgeons have looked at a difficult problem and sequentially improved care. And we learned how, by this story, how they went from very simple surgeries, which are dominated by trauma, and that's because of the reality of the war. But now as the war is becoming more of the past, we understand that the needs are throughout neurosurgery, the benign tumors, the congenital anomalies of the children. And that care, which is being delivered at the highest ranked hospitals in the country, must spread throughout all the people. And so systems of care, the lesson we learned in the first talk, becomes very important here in the second talk. And that means we think about equipment. That's what we always focus on. It's really probably only one of many important points to really solve this problem. If you have the quality people, and Afghanistan does, then you start to think about systems which include equipment, of course, but also transportation. When a country spreads out and the people are spread out, the care of the large population may be lost and only care to the people closest to the capital. That must be solved. That is generally solved by dispersing the training areas to the second and third largest cities of the country, which you heard Dr. Prasad talk about as it went to Kandahar and other countries, where other cities and regions in their country. But then you think about your partners. To really build neurosurgery, you build critical care, you build anesthesia, and you build imaging. In each case, we talked about stories of, how we overcame something once we could image it, or how we had a very critical patient. But what we left out is the critical period of the next 2 to 7 days after the surgery, where they survive because of our postoperative care. So systems of care become very important. This is what I call integrity. Integrity is not just the quality of one person, but integrity is from the Latin for whole. In other words, when we have integrity to the entire problem, we look at the entire system of care or the entire patient. And the final point which was raised, which we have a responsibility to address, is corruption. Because I assure you, the countries and regions of the world where we rapidly improve care are the ones that have addressed corruption. And the ones where we have the most problems are the ones where there is a lack of peace or aspirations for improvement, or a society that allows the best and brightest people to succeed, because then they stay in their country. If they cannot succeed in their country because of corruption, they will leave. So neurosurgeons must understand that people such as Professor Prasad have immense respect of the people around them. And we must use that platform to really benefit our society, so that it will be a society where our trainees are respected and safe, and their families are safe. So there's so many lessons here, but I want to congratulate Dr. Prasad, because that first lesson, the quality of the people, comes from the mentors, which he has been a mentor for so many in his country. And they respond in how they are taught, and that's how we make change. But we do it by looking at the entire problem. Excellent presentation, Professor. Thank you.
Thank you very much, Professor Prasad. That was a wonderful lecture. We are really thankful to you for providing your mentorship role to the young neurosurgeons of your country. The ACNS will definitely look into your request, and we will reciprocate through the WFNS as well as the ACNS. Thank you so much. Yes, Professor Aziz Sultan would like to comment.
Yeah, to me, this was one of the best talks that I've ever heard. It spoke to my heart. It spoke to the incredible intelligence and resilience that the Afghans have had. Afghanistan is now in the media, terrorists and this and that, but this is where Rumi and some of the major Avicenna and major foundations of medicine and philosophy. This is where it all came from people like Dr. Pirzad. And yes, there's low resources that we have to ask the WFNS and so forth. But when I was there was $29 billion sent into the country, all military and so forth. What about the basic needs of the people? What about healthcare? What about food? What about shelter? Is the international community's approach towards places like Afghanistan wrong, right? Is the war machine and all the resources sent a complete waste as it's proving out to be? And should people like this and the healthcare systems and education of the country should be supported? It's a question for all. You know, we're being led by politicians when we should be led by humanitarians and doctors and academicians. But that's probably beyond the scope of what we're talking about. Thank you.
Oh,
Thank you, Dr. Pirzad. That was wonderful.
I really do echo the point Dr. Aziz Sultan made, is that we are the thought leaders. And when we make healthcare, and when we make healthcare the priority of the country, or food, or opportunity, we retain the bright youth, we remove the corrupt politicians, and we begin to make change. And so I believe, because I think about this, what can I do? And by providing healthcare, I think we can change societies and make it a reasonable place to live. And you know the history of richness from this country, which was just mentioned, it will rise again because of the quality of the people given the opportunity. Outstanding points.
Thank you so much. Yes, my co-host Liu Bun Singh would like to say something.
Hello, Professor Pirzad. First time meeting you. Actually, one of your colleague is working in Malaysia. I'm working with him, I think, more than 6 years. I heard a lot of story about Afghanistan, sadly, because of the war that have caused a lot of disaster. And he did show me some nice photo before the war. So it's a very nice country. It's almost like Malaysia in 70s. And I'm very proud and happy to hear from you and to know the real story in Afghanistan. And I also think that it's a proud news for everybody that you have over 70 neurosurgeons in your country, although it's still a small number for a country, but thanks for your effort. My question is what do you think that, I think the more important is about the geopolitics and the local problems that the people need to face despite whatever international aid that can be delivered. What do you think that most needed, especially the basic care in your country? I believe neurosurgery is not only limited to a neurosurgeon, but a team of people to work together. So do you think that there is a need to develop the whole ecosystem in neurosurgery, including the nurses, medical assistants, anesthesiologists? I need to get your opinion, Professor. Thank you.
Thank you very much. Thank you for Dr. contribution and nice words from Professor Dempsey, Dr. Ali, Dr. Omar, Dr. Liu. Thank you very much. And yes, sure, as a team, we need nurses, physiotherapists, anesthesiolog, and also radiolog. This is very important, and but in Afghanistan, not proper training for nurses, and this small steps for starts with our colleagues Professor Dr. Ashmat Rehmi, that he likes to train nurses for, especially for neurosurgery, and I would like to thank him. And for neuroimaging and radiology, it's important to train neuroradiologists. And also we have faced with anesthesia and neuroanesthesia. We have colleagues that's good experience with neuroanesthesia, but we have faced with difficulties also. But ICU, we have ICU, but not good care. Sorry for that. And we had 40 years ago, radiotherapy and radiotherapy in Afghanistan. Unfortunately, during the war, this destroyed, and we have lost all of them. And our people for radiotherapy and chemotherapy going abroad. And this is not good for our poor people. Thank you very much.
Thank you, Professor.
Thank you very much. If there are no further comments, we can conclude this session. Sachin, would you like to say something?
Yes. So myself, Dr. Sachin, and I work with Dr. Adam for the Afghanistan support group. I'm the co-chair of the ACNS YNS. Congratulations, Dr. Prasad, for the wonderful presentation. I work in one of the corporate hospital in south part of India, and we do get regular patients from Afghanistan. Many of bullet, gunshot injuries, and few children, school casualties, what you mentioned. And I can definitely understand your situation, because here we have a total good high-tech infrastructure to take care of that. And the condition you are working in, it should be definitely a very difficult task for you, but what you're doing is a phenomenal job. I've got one question and one request. The question is, now in this COVID pandemic, what is the impact of COVID pandemic on the practice of neurosurgery in Afghanistan? One thing. And as we are discussing about the partnership of different communities along with Afghanistan neurosurgery to build up, this partnership will not happen without involvement of few of your neurosurgeon into the society. So since there is this ACNS YNS society, and we are still in the process of recruiting different members from different community, I would request you to nominate or suggest us 2 young neurosurgeons less than age of 40 years who would be a good sort of leader and will help us to build up the more connection and more sort of education and training in the neurosurgery in Afghanistan. Thank you very much.
Thank you very much. I'd like to thank you, Dr. Sachin, and also I like to say that I was in Malaysia, and our colleagues, Dr. Javed Khan is in Malaysia, and he practicing neurosurgery, and we proud of him. And we have a lot of colleagues in India, Dr. Mishra, Dr. Atul Gol, and the last ACNS, I was in Mumbai before COVID, and I have good memories about this time. And for your question, we are faced problems during COVID-19, but we service for our people. You hear that we have a lot of mass casualties, a lot of explosion and suicide bombers, and we have a lot of trauma cases. We must work, and we take care of our colleagues to cover with masks and personal protection support, and also for distance. But we unfortunately we lost a lot of doctors in Afghanistan during COVID-19, and one of them, our teacher, was Professor Pakilman. He was known neurosurgeon and previous president of Afghanistan Neurosurgical Society. Rest in peace. And also we have lost Dr. Khalil, Taijan Khalil, and also we lost him in COVID-19. But we back. I will introduce our two young neurosurgeons for Dr. Sachin. Thank you.
Thank you. Thank you very much, Professor Pizza.
Thank you so much. I think it's time we can conclude. Over to Professor Dempsey to hear his concluding remarks.
I want to thank everyone for their participation in this very important seminar. It gave us the opportunity to look at one particular country of great history and great promise, where very brave people have worked very hard to care for the people of their country. And we are obliged to help, but to partner. We learned that the mistakes made from other countries of trying to simply dump aid and direct aid for political or war purposes have not been helpful to the patients. We've learned that the real heroes are the people that are trying to transform their society for the benefit of their patients. That's something we can partner with, and that's something we are proud of. And therefore our organizations do, but we must do it thoughtfully with plans to look at the entire infrastructure, the equipment to be spread throughout the country and not simply, something that's a very, very obscure little technique for one place, but something that serves the greater good. And we've learned, most important of all, is that when we become involved in such efforts, we begin to associate with outstanding people like Professor Prasad, and it makes us better people. And for that, I am very grateful. Thanks very much.
Thank you. Thank you so much for those wonderful words. So I think it's time we'll wind this up. On behalf of the Education Committee of the ACNS and the President, Professor Yoko Kato, I would like to sincerely thank both the speakers for today, Dr. Adam Amar and Professor Fawad Pirsad, for coming here and giving us insights into global neurosurgery and neurosurgery in Afghanistan. Thank you to both the chairs, Professor Abdus Ahmad Al-Wahabi and Professor Robert Dempsey, for chairing this session. We are extremely honored to have you today. And special thanks to my co-host, Dr. Liubun Singh and Sachin, who joined me today for this webinar. So until we all meet on next 29th, it is bye-bye from all of us. Thank you all the distinguished faculties, especially Professor Aziz Sultan and other dignitaries who joined from Afghanistan as well.